What's up, everybody? Dr. Jesse Ritter here. Today I'd like to talk about a topic that I am very, very passionate about, and that is this whole difference between comprehensive, complete, or holistic dentistry, might be called any one of those three things, and more basic type dentistry. It's something that it's very difficult as a patient to know what type of dentist that your dentist or maybe the website you're looking at or the dentist that your friends told you about, what type of dentist they are. I talk about cosmetics a lot because that's something that I'm very, very passionate about. I think that transforming somebody's smile is one of the most satisfying and impactful things that a dentist can do for a patient. The concept of comprehensive, though, is equally, if not more important, when it comes down to like what type of dentist do you want to have. Now, traditional dentistry, when you think about like basic sort of dentistry, maybe dentistry of the 30, 40 years ago, even though comprehensive dentistry was around then too, what most people associate with dentistry is this, you go in for your new patient exam and you actually a lot of times will just see the hygienist, you get your teeth cleaned, the dentist will then come in, do a real quick exam, get a chance to meet them, maybe have a short conversation with them, and then they'll tell you if you have cavities, they'll tell you if you have gum disease, and talk to you about brushing and flossing. And that's sort of the more basic model of dentistry. And that is, unfortunately, and there's no judgment here, there's no like right versus wrong. Unfortunately, that is still the type of dentistry and the way that dentistry is practiced in some dental practices in the US is all I can really speak to. But there is another way, and there's also variations in between. Every dental practice is unique. But from a patient's perspective, when you're looking for a dentist, you want to know, do they treat comprehensively? Do they give that option, right? I myself personally, I give everybody the option to choose the level of care that they want. Not everybody wants quote unquote comprehensive dentistry, right? They want just emergencies taken care of. They just want when something is hurting or it's broken, they just want it fixed. They don't want to talk about cosmetics. They don't want to talk about their bite, things like that. So that's okay. But I think that it's an important thing for the dentist that you're looking for, or if you're out there in the market kind of searching for a dentist, or you were referred to a dentist, before you go and see that dentist, that you visit their website, you get a feel for, do they give you the option, right? Is it customized to you the way that you're treated? So let me give you an example of how we do it in our office so that you can just kind of have something to gauge things off of. So in my office, one of the intake forms that we have involves patients sort of looking at 5 different classifications and levels of dentistry that we can offer them. And it starts with, we'll just say like the most basic one is that you just want to be treated for emergencies. So if you're in pain or you break a tooth, then that's how and you just want us to fix that and nothing more. You don't want to come in for regular hygiene appointments, anything like that. Even treat other cavities that you have. You just want that. That is an option. Right? We want to kind of know, is that where you're at? Is that what you're used to? Is that what you expect? Right? And then at the opposite end of the spectrum is the option to go, I want to know, you can choose, it's the comprehensive and cosmetic option. It's the complete and best way, the complete and best way that we can treat you. And that is, it's everything involving, those basic things, treating emergencies, broken teeth. We're going to treat decay. We're going to be proactive with teeth that could break. We want to get those teeth crowned proactively. We want to sort of forecast problems that could happen and get ahead of them. Also, we're going to look at your occlusion and how the whole system works together, your joints, your muscles, your teeth, so that we can mitigate force in your mouth and make sure that things last and don't wear, break down over time. And then lastly, we're going to talk about the cosmetics, right? So you want your teeth to look good. You want them to if they don't look good now, you're interested in talking about change. If they do look good now, you're interested of maintaining that, so that your teeth are always looking good. Otherwise, or in other words, you consider cosmetics important, okay? So that just gives you kind of an idea, gives us an idea, of where you sort of fall in the spectrum. And then we can kind of say, okay, this is kind of the area you've chosen. And we just want to kind of review that with you and see if that really is where you want to be, or if that's maybe just where you feel you are, or where historically you've been. Because here's the thing, is when people, they think that this is what they want, or they think that that's how it has to be, or there may be only an awareness around this is what dentistry is. Dentistry is, and maybe you've only known dentistry as, oh, you treat emergencies, and when something breaks, you get it fixed. Sort of like when you go to the mechanic to get something fixed with your car, right? But other people, but there's an awareness that comes in that conversation that we have with you, where we give you the option, like there's an opportunity to move up, right? There's an opportunity to move up in how you want to be treated. And that can be because you're ready to make a change, you're ready to think about things more comprehensively. Maybe you're willing to invest more in your health and in your teeth, or something's changed in your life recently and you feel like I can do this now, or I'm ready to do this now. It just all depends, right? It's fully customized. And that's the point I want to try to make, is that it's really important that when you are choosing a dentist, or when you're considering switching a dentist, or you're considering getting cosmetic work done even, right? I love cosmetic dentistry. I love to provide that for patients, so I have to bring it in here. I just can't leave it out. If you're pursuing any of those things, right? Looking for a new dentist in any way, no matter what it's for, and you are the type of person who believes that they want to have the option to have their entire system looked at, to be treated more comprehensively, to not just be treated for emergencies or broken teeth, or just focused on decay and gum disease. They want more. You want to know more about the force being put on your teeth. You want to keep your joints healthy, your muscles healthy. You want your teeth to look good on top of all those other basic things. If you want to have that option, you really want to do your research and make sure that the dentist that you end up or considering going to, that they offer those things, right? Again, not everybody wants that. Not everybody needs that. And I have to say it, I have to be frank. Maybe not everybody can afford that, right? Maybe that's really not in the cards for your specific financial situation. But if you feel like you at least have curiosity around knowing more in depth what's going on with your mouth, being more proactive, and preventing problems before they happen, comprehensive dentistry is the way to go. You want to find a comprehensive dentist. So the name of my practice is Smile Solutions of Baltimore. I didn't just make that up and say, great, that sounds good. I actually believe that, and I'm very passionate about, smiles are important, yes, but solutions to your problems are important as well, right? And doing in-depth exams and treating you in a comprehensive way, even if we are focused on doing cosmetic work, there's a responsible way to do cosmetic work, and there's an irresponsible way to do it. And you've got to factor in all the different factors with your bite and your overall health, maybe even your sleep, if you have obstructive sleep apnea, all kinds of different factors that go into that. And that cannot be taken lightly, even when you're you're just focused on cosmetic work. So I hope that this information was helpful to you. And if you have any comments, please post them or send them to me, email them to me. Thank you so much for watching this video, and I look forward to seeing you on the next one.